Today we are reporting on the 3 periods over this past weekend. From Friday to Saturday, we had 881 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 847 new cases, and in the last 24 hours, 763 new cases of COVID-19. That brings our total to 2,491 new cases diagnosed in British Columbia, and our overall total to 126,249 people diagnosed with COVID-19 in British Columbia. Of the new cases, 466 were in the Vancouver coastal housing, 632 were in the Fraser Health Region, 82 were people who lived in Vancouver Island Health Region, 206 people lived in the Interior Health Region, 104 people in Northern Health, and one was a case in a person who normally resides outside of Canada. We currently have 8,199 active cases in all areas of the province, and 484 people are in hospital with COVID-19 right now, 158 of them in critical care or ICU. We have 12,340 people under active public health monitoring, again all over the province, and 116,241 are in the recovered range. We've had one new outbreak to report since our last reporting period at Orchard Haven in Interior Health. So that brings us to 8 active outbreaks in long-term care, assisted living or independent living, and 7 in acute care facilities. Over this past weekend, we've had 17 more people who've died from COVID-19 in British Columbia, bringing the total number of people to 1,571. As always, our condolences and our thoughts go out to families who have lost a loved one during this pandemic, and also to the care providers in the communities. Our thoughts are with you during this very difficult time. And I just want to give a little more detail about the people who died over this past weekend. One of them was a person who resided in one of our long-term care homes that had an outbreak. In addition, by age group, 2 of the people who passed away over the weekend were over the age of 90. 7 were in the 80 to 89-year-old age range. 5 were in the 70 to 79-year-old. 2 in the 60 to 69-year-old age range. And 1 person was in the 50 to 59-year age range. Again, this shows us how devastating this virus can be on people who are older. There has been some concerns expressed in other parts of the country about people who are dying at home from COVID-19, and that, of course, is a terrible tragedy. Here in British Columbia, any sudden unexpected death, as they're called, are investigated by the coroner's office to understand the cause of death. And since the start of this pandemic in March of 2020, we have been working with the coroner's office to establish a protocol that includes COVID-19 assessment for a potential infection with COVID-19 in all sudden unexpected death investigations across BC. As always, the coroner's investigation can take several weeks to months to complete, depending on the complexity of the situation. And should it be determined that COVID-19 was either a direct cause or one of the underlying factors in a death, the coroner has a process where the families are notified and the information is reported to public health in our COVID-19 data reporting. We've had several hundred deaths that have been investigated by the coroner's office since March of last year, and a very small number of them have been determined to be due to or related to COVID-19. Tragically, one of those was earlier this year in January. An infant died, an infant from the Interior Health Authority. Was being treated at BC Children's Hospital and died. And the coroner's investigation, which concluded last week, determined that COVID-19 was indeed a factor in this infant's death. This is, of course, the youngest death that we have had, tragically, in our province from COVID-19. And I'm reporting this today as the The report from the coroners will be included in our weekly surveillance report this week. The family has been notified, and Interior Health is working with them. And the privacy, of course, of the family is paramount, and we won't be adding any additional information, but just recognizing the tragedy of a young life lost. I'd also like to note, though, we have seen a spike in cases in the last few weeks. We have been working closely with the coroner's office, and we have not seen an increase in sudden unexpected deaths related to COVID, or even to be investigated as possibly related to COVID in the last few weeks, and we will continue to work with the coroner's office to monitor this. I will remind everybody that if you have COVID-19 and you're isolating at home, if you have any health concerns, you can call 811 to get support and advice. You can call 911 if you have shortness of breath or any other concerning symptoms and need care. And this goes for anybody with COVID or with other health conditions. Our hospitals are absolutely stretched right now, but our doctors and nurses and care staff are there to provide the service that people need. Our emergency departments are ready and active and safe for people to go, whether it's for COVID or for non-COVID related emergencies. To date, in our vaccine update, we've delivered 1,635,372 doses of the 3 COVID-19 vaccines across BC. 89,035 of those have been second doses. And I want to remind everybody that's over 18 right now that you're eligible to register in our program, in our system, for your vaccine, and that will make it the most efficient way to be notified as soon as your age category is eligible for booking of appointments. And we're now booking appointments for people in their 60s and into the high 50s in the next day. I'm also hearing that some people may be concerned that the information we're collecting to be able to record your immunization and make sure it gets into our provincial immunization registry is they're concerned about sharing of this personal health information while you get your vaccine. I can reassure you that that is not the case. Any information we gather is personal health information that is protected, and your privacy is protected, and it is not provided to any other agency or part of government. And I know this has been a concern for new Canadians, for people who are here visiting, and for people who are here on temporary visas, etc. Our goal from the very beginning has been to provide a safe and effective vaccine to everybody in British Columbia. Whether you are a citizen of BC or a normal resident of BC, whether you're a citizen of Canada or whether you're here, because we know that providing vaccine to everybody is what protects us all. And we have had a program from the very beginning to provide vaccines to our temporary farm workers, for example, recognizing the essential work that they do in our communities. And we provide it at the time when they're in the quarantine services that we as BC have provided to make sure that people are here and are safe before they go into our communities, and that they as an individual are protected as well as our community. We also have been providing immunization to rotational workers and others in the province, so do not be afraid that you are not eligible for vaccine or that your personal health information will be shared with any other government agency. It's important for all of us to get immunized when our turn comes up, and we can be proud when we get that and be happy when we get our vaccine. And I know there's been some concerns that people are afraid to share their pictures of themselves getting immunized, but this is an important time of hope for all of us, and everybody will have the opportunity to receive their first dose of vaccine in the next 8 weeks, within the next few months. So when we are immunized, we protect not just ourselves, but we protect our co-workers, we protect our families, the people we live with, and our communities. So all of us should celebrate every single vaccine dose that's given in our province, and I encourage everybody to step up when you're offered an immunization, when you have that appointment, to go ahead and get your vaccine too. Our goal as we've talked about, is to prevent severe illness and death, and that's why we have focused from the beginning on those most likely to experience those, and that is by age. But we also know that some people's health condition makes them more at risk. And we know that it is some people as well who are who must go into work every day, who are exposed to others in the community that put them at increased risk, and we've targeted programs at those people as well. So we want to make sure that we stop severe illness and death, and the good news is that all 3 vaccines that we have available have been shown to do that and to be very effective at preventing people from being in hospital. And there's more data that came out of the UK that's been recently published that showed that both AstraZeneca and the Pfizer vaccine are highly effective at preventing people from needing hospital care. And that is important right now when we are seeing a burden on our hospital system and on our ICU system. So everybody who's offered a vaccine right now can be confident that it is protecting them and will protect our healthcare system. We also know that we talk about the concerns about community immunity, and it is very much protecting us from transmission, and it'll be a time before we can get to that place where all of us can let our guard down a little bit. So even if you have been immunized now, it does take some time before that protective level comes, and that's 2 to 3 weeks. And in that time, we all, right now, need to continue to do those things that prevent our transmission of the virus from us to somebody else. We talk a lot, or we hear a lot of talk about variants as if they're some separate entity, and really the fact that a new strain arises and that we're able to detect it is more a testament to the laboratory systems we have now, particularly whole genome sequencing, that allows us to watch the natural mutation of viruses in real time and determine if there's specific mutations that give that strain of the virus a competitive advantage. But when we talk about variants, we are still talking about people who are infected with COVID-19. And it is the things that we do that prevent us from getting infected or passing it on to others that remain the same, no matter which strain of the virus we're infected with. COVID-19 is not about where the virus mutations come from, whether they were initially detected in India or in Brazil or the UK. It really is about the things that we do now, that we know how to do, that prevent transmission with whatever virus we have at the moment. And that means to stay local in our communities, to reduce the number of contacts we have, to always use our layers of protection, including wearing masks when we're in indoor public spaces, to make sure that we keep our safe distance from people, that we do things outside and at a distance, not inside as much as possible, and that we go and get our vaccine when it is our turn. We need to keep doing all of these things for the next few weeks until we can get everybody protected from COVID-19. And we need to remember that this time, when it is so challenging and there's so much potential, we need to remember to be kind to each other, to stay calm, even though it is challenging, and to stay safe. Thank you.